Welcome everyone to this evening's webinar entitled Eating Right, Nutrition in Cirrhosis. This is a part of our webinar series for summer 2020, where we discuss what to eat, what not to eat for specific digestive conditions. Tonight we are discussing cirrhosis. Presenters for this evening are Dr. Deepti Raju, who is a transplant hepatologist at Stanford, and Ms. Yvonne Fong, a dietitian specializing in liver disease. Without further ado, here is Dr. Raju.
Thank you, Dr. Kim, for the kind introduction. My colleagues and I are so excited to be with you all today to talk to you more about the myths and truths surrounding nutrition and cirrhosis. It's a really important topic, and we have an exciting 1-hour webinar planned for you all to delve more into this topic. Just to give you a brief overview on how the webinar is structured today, I will be starting off by giving some medical background on why nutrition is so important in cirrhosis, and then I'm going to hand it over to my colleague in nutrition, Ms. Yvonne Fong, who will be giving you some practical strategies that you can implement in your daily lives. And then we're going to conclude with a live Q&A session that is going to be moderated by one of our nurse practitioners, Ms. Caitlin Killian. So without further delay, let's talk about the normal function of the liver. The liver is a really important organ with a number of important functions. The liver produces cholesterol. It makes important proteins that our body uses. It produces a material called bile that's really important in the digestion of fats. It stores the glucose that you're not using right away as energy as a substance called glycogen within the liver, and then subsequently gives that out as you need energy. It produces clotting factors that help us to clot our blood when we sustain an injury. And it has a really important role in detoxifying the blood. Everything that we put in our mouths, medications, food, all of that is cleared by the liver. And so the liver has a really important role in making sure that toxins don't build up in the blood. So let's start off with our first myth or truth. Liver disease causes the body to use more calories and leads to muscle breakdown. Is this a myth or truth? This is an absolute truth. Before we delve into why it's a truth, let's talk a little bit about malnutrition and what does malnutrition mean. Malnutrition is synonymous with undernutrition. It leads to a decreased physical and mental function and can worsen the outcome from any disease process. And in patients with underlying liver disease, up to 20 to 60% of the patients are malnourished. We know that how severe the disease is correlates with how prevalent malnutrition is and how severe the malnutrition is. But even in those people who have cirrhosis and their liver is doing the job it needs to do for them, they are compensated, up to 20% of those patients will still have some level of malnutrition. And as patients get sicker and are struggling more with the side effects associated with liver disease, things like ascites or confusion, encephalopathy, up to 60% of those patients are malnourished. We know that cirrhosis is a hypermetabolic state. It's a state where you're expending more calories than what you would expect to be expending. There was one study that showed that the resting energy expenditure was actually 20% greater than what they had predicted in almost a third of the patients who had well-compensated liver disease. So these are patients who have cirrhosis, but their liver does the job it needs to do for them. And when you are to look at them, you wouldn't know that they had underlying liver disease. Even in those patients, they had a higher baseline energy expenditure than what was predicted. And this is thought to be due to cytokine activation. Cytokines are proteins that play an important role in causing inflammation and help with the immune response in the body. And so if you have an inappropriate activation of this, it may lead to this high metabolic state. We also know that cirrhosis is a state of accelerated starvation. We talked about earlier that one of the important normal functions of the liver was to be a reservoir to store this substance called glycogen, which can then be converted to glucose and give you the energy that you need when you need it. We know that patients with cirrhosis are deficient in their ability to store this glycogen. And even with minimal fasting, like an overnight fast when you go to sleep, is enough to push you into a starvation state where the body has run out of carbohydrate reserves and is now turning towards fat and protein breakdown in order to give energy. In healthy individuals, that process takes up to 3 days to develop. But in somebody with underlying liver disease, it can happen in as quickly as an overnight fast of 8 to 10 hours. And so Ms. Fong is going to talk to you a little bit more about what we can do to combat that. We know that cirrhosis is a state of malabsorption. We talked about how the liver has an important role in synthesizing a substance called bile, which is important in fat digestion. So in patients with underlying liver disease, fat-soluble vitamin deficiency is not an uncommon thing to see. So vitamins A, D, E, and K are the fat-soluble vitamins, and patients with underlying liver disease are at higher risk of being deficient in those vitamins, as well as micronutrients like B12, folate, and thiamine. So it's really important to make sure that these vitamin levels are checked and that they're repleted appropriately. And in general, having underlying liver disease can actually lead to a lack of adequate intake of food for a number of reasons. One, if the patient is having a lot of fluid in their belly, ascites, then they may just get full a lot quicker than what would be otherwise normal for them. So they have an early satiety. They have dysgeusia, which is an alteration of taste. So food just doesn't taste right. And oftentimes, unfortunately, patients with liver disease are hospitalized frequently for procedures that require them to be nothing by mouth. So in those situations, we are making them go into a fasting state when we know that they don't tolerate it as well due to the need of having to do a procedure. So for a number of reasons, patients with liver disease have a lack of adequate food intake when they already have increased demand for nutrition. So what's our second myth or truth? Individuals with liver disease should follow a low protein diet. This is absolutely a myth. Protein intake is actually a priority in patients with liver disease. We know that it's essential in preventing muscle breakdown and muscle wasting, which the medical term is sarcopenia, and to maintain their lean body mass. So for patients with liver disease who are not obese, we recommend 1 to 1.5 kilograms of dry body weight of protein daily. For somebody who's 175 pounds, that's 80 kilograms of weight. We are recommending 80 to 120 grams of protein a day. So it's a lot of protein. There are studies that suggest that higher protein intake is actually associated with an improvement in hepatic encephalopathy. Many years ago, there was a thought that maybe this was not the case, and actually protein intake made encephalopathy or that confusion associated with liver disease worse, but that is not the case. We know that it actually might prevent encephalopathy. So for that reason, we do encourage a high protein diet in our patients with underlying liver disease. And within protein, what types of protein? Well, we know that there's branched chain amino acids, which are a building block of proteins. And these may have a particular role in improving the condition of patients with underlying liver disease, especially in relation to encephalopathy. So amino acids are the building blocks of protein, as I talked about, but the branched chain amino acids may also have a role in detoxifying ammonia in the blood. We know that patients with underlying liver disease actually have an imbalance in these branched chain amino acids, and there are some studies that show that supplementing the branched chain amino acids may actually improve the encephalopathy. And so we encourage adequate supplementation of these types of proteins. whether it be through your diet or through supplementation. But there's an issue because of cost associated with supplementation. And oftentimes the supplements may not be as palatable. So natural sources of branched chain amino acids include eggs, chicken, lentils, and soy. What is our third myth or truth? If I have cirrhosis and I'm overweight, I must not be malnourished. This is an absolute myth. Being overweight with underlying cirrhosis does not rule out malnutrition. There's a term coined for this specific type of person. It's called sarcopenia and obesity. It means that there's a loss of skeletal muscle with the presence of fat tissue. And we know that this is independently associated with a higher risk of mortality and a higher risk of having comorbidities or suffering from complications associated with the disease. We also know that relying on something like the body mass index or the BMI in patients with cirrhosis is difficult because volume status fluctuates greatly in our patients. And so how do we even measure their weight? In patients who've got a lot of fluid, especially patients who have ascites, we think that measuring their weight after a paracentesis may be the best measure of what their weight actually is. And for patients who can remember what was their last weight before fluid became an issue, that might be called their dry body weight, and we would use that weight. In this picture I have here, this actually shows how patients with obesity may actually have decrease in that skeletal muscle mass. And these are two patients on a CT scan of both patients where the red is showing the skeletal muscle and that grayish area is showing the fat. And you can see that the skeletal muscle varies in quantity between the two patients. There's very little data in the field of sarcopenic obesity. It's an up and coming field that we're learning more and more about. We know that management strategy is likely going to include a combination of building up muscle mass through weight training and restricting calories to some extent to cause fat loss. But this is a very complicated proposition, and it has to be done in conjunction with a dietitian who has expertise in cirrhosis, because we know that patients with cirrhosis have very unique metabolic needs. In general, it's thought that a 5 to 10% body weight reduction is associated with halting progression of disease in those patients with compensated cirrhosis, and that's been shown in a number of different trials. I just wanted to talk about volume status and sodium intake. We generally recommend a low to moderate sodium intake diet for our patients with underlying liver disease, which is a 2,000 milligram diet of sodium a day. Why does sodium cause an issue with volume status in liver disease? Well, we think it's related to portal hypertension. So patients with underlying liver disease and who have cirrhosis have a scarred liver. And we know that the way the blood flows through that scarred liver causes the blood to flow with a much higher pressure. And as a result of that higher pressure, we know that the fluid seeps from out of the vessels into spaces where it's not supposed to be. And so limiting the sodium intake allows for that fluid to not seep out as much. But this you have to weigh with the potential risks and benefits of having inadequate food intake due to the lesser palatability of a low sodium diet. So it's really important to kind of weigh the risks and benefits of eating a low salt diet along with the benefits of eating a low salt diet. So you want to make sure that you're eating a low salt diet that's well balanced in protein rich foods as well. So just some take-home points. So we know that having cirrhosis increases the risk of developing malnutrition for a variety of different reasons, which we touched upon earlier. We know that the optimal daily protein intake is between 1 to 1.5 grams per kilogram of dry body weight, and that this can be obtained through a variety of sources, including animal and plant-based sources. We know that cirrhosis is a hypermetabolic state. And so we want to avoid periods of prolonged fasting, and we want to encourage a late bedtime snack to prevent and break up that prolonged fast. If you are overweight and have an underlying diagnosis of cirrhosis, it does not mean that you are that you can't be malnourished. You can have muscle wasting and be malnourished, and these need to be assessed by a nutritionist and your doctor. So if you have concerns about your nutritional status, we really encourage you to reach out to your doctor regarding your concerns and consult with a dietitian with expertise in cirrhosis as we think is needed. Thank you very much, and I'm going to hand over the next portion to my colleague, Ms. Yvonne Fong.
Thank you, Dr. Raju, for the excellent background on liver disease. I'm Yvonne Fong, the liver dietitian at Stanford, and I specialize in working with the liver transplant population. Now that we have a better understanding of what liver disease does to your body, let's talk about the practical ways we can change our diet and nutrition. So, myth or truth number 1, I cannot change the course of my disease through what I eat. So what do you all think? I hope from the earlier presentation that we emphasized it enough that you have learned that there are many ways that we can impact cirrhosis with our diet. So this is most definitely a myth. So the main concern that we have for patients with cirrhosis is the development of malnutrition and sarcopenia. Therefore, if you notice any muscle loss, especially in your arms, shoulders, or face, or unintentional weight loss not related to fluids, we recommend following a high-calorie and high-protein diet with a bedtime snack. Also, many tend to lose their appetite or get full easily from ascites or fluid buildup in the stomach area. So we'll talk about strategies for what you can do when you don't feel hungry. Here are some high-calorie foods that you can try adding to your diet. The strategy here is if you're not feeling very hungry, we want you to pack every bite full of calories to prevent more weight loss. I like to focus on adding healthy fats first, but if you are very malnourished and not able to eat much, adding all types of fat is fine. So first, here we have an avocado, olive oil and butter, nuts and seeds and their butters, dried fruit, trail mix, and granola, with granola being the highest amount of calories out of that group. You can see just adding 1 tablespoon of olive oil or peanut butter is enough to add 100 calories to whatever you're eating. Then we have dips such as hummus, bean dip, or spinach dip. There's salad dressing and mayonnaise. These are great ways to add calories to your crackers, bread, or vegetables. Dairy products are also high in calories if you choose the whole fat option, not the low fat, fat-free, or the diet options. This includes milk, Greek and regular yogurt, ice cream, cream cheese, sour cream, and heavy cream. Coconut milk also has calories as well that you can add for making curry or add to your soups. And lastly, you can make milkshakes and smoothies filled with these high-calorie ingredients that I just shared with you. Moving on to protein. So there are several different sources of protein. First, the most popular one and well-known is the animal protein. We recommend fish, chicken, and turkey over red meat, such as beef and pork, as they were lower in saturated fats. Red meat and processed meat, such as bacon and sausage, have been found to worsen your liver disease, and so we recommend eating it no more than 1 to 2 times a week. Next, we have dairy and eggs. And then my favorite source of protein are the plant-based proteins that you can see here in this photo include soy and tofu, legumes, beans, lentils, nuts, and seeds. And they're low in saturated fats and really high in fiber. So that's why they're great for you. If you are dealing with hepatic encephalopathy and confusion, plant-based proteins have been shown to be better tolerated by your liver. So first choose plant-based proteins, then dairy, and then lastly, animal proteins if you're dealing with that. You can also get protein from protein supplements, such as protein powders, protein bars, and shakes. So how much protein should you be eating? So based on the protein needs for liver disease that Dr. Raju shared earlier, this ends up being around 60 to 80 grams of protein a day for females and 80 to 100 grams protein a day for males. You do not want to follow a low protein diet as that can worsen your liver disease and symptoms. If you are typically eating beef, try switching to a non-red meat like chicken that we see here, or fish. One serving of animal protein is considered 3 to 4 ounces, which is the size of the palm of your hand or a deck of cards. If you are eating plant-based proteins, like the legumes here or beans that you see here, one serving is about a cup or the size of your fist or a baseball. So if you think about it, it takes a lot of effort to meet these protein goals. So you do have to make sure you incorporate protein with every meal. So because of the accelerated starvation state that happens with liver disease, we recommend adding a bedtime snack to combat this. It only takes 6 to 8 hours of not eating for this to happen, and oftentimes the gap between your dinner and the next meal in the morning can be more than 8 to 10 hours. If you also end up waking up hungry in the middle of the night, which has happened to many of my patients, it's okay to eat. Listen to your body and feed your liver. For your bedtime snack, we want it to be high in carbohydrates, preferably complex carbs with fiber and some protein added to it. Here are some examples of what a 50-gram bedtime snack would look like. So you could do a PB&J with 2 slices of bread. You can do milkshakes or smoothies. There's also rice, pasta, congee, hot cereal, cold cereal, beans, yogurt. You have bagels, Asian or Mexican sweetbreads, tortilla, naan, pita breads also count. There's also protein bars and nutritional supplements as well that you can choose. Many of my patients often do not feel hungry. So as a dietitian, this is the only time you will hear me say that you shouldn't listen to your body or your hunger and fullness cues. If it's telling you that you're full, but you've barely eaten anything or only eaten one small meal for the day. So first off, you must eat, even if you do not feel hungry. Do not skip any meals because again, that can trigger that starvation mode and cause breakdown of your muscle. Liquids such as smoothies, milk, and nutrition shakes pass through your stomach much faster than solid foods. So if you're getting full easily, get your calories and protein from liquids. If you can only eat a little bit at a time, that's okay. Eat those small portions, but eat every 2 to 4 hours by adding snacks 3 times a day, especially at bedtime. Get your bang for your buck and choose those high calorie and high protein foods that I recommended earlier. You can also fortify the foods that you're already eating, such as adding extra olive oil to your vegetables. Instead of eating plain toast, make sure to add some butter or peanut butter to it. You can also find high calorie and high protein specialty food products in the grocery store, such as Kodiak cake products, Lenny and Larry's complete cookie, or nutritional shakes. If you are really struggling still with putting on weight and having a poor appetite, there are medications that can help with your appetite, so you can talk to your doctor about that as well. Now, for our second myth or truth. Following a low sodium diet with moderate fluid intake is helpful to manage fluid buildup in my legs and stomach. This is most definitely true. So you want to aim for no more than 2 grams of sodium a day in your diet and less than 1.5 to 2 liters of fluid a day as well. However, I know that a low sodium diet may not be the most tasty or palatable, so if it does negatively impact how much you are eating or you are already not eating enough, you can work with a dietitian to find foods that work for you. You might hear salt and sodium often used interchangeably, but they do not mean the same thing. So salt is a crystal-like compound like what you see in this photo here, whereas sodium is a mineral that is found in salt. So table salt, like this salt here, is actually made up of both sodium and chloride. So when you're reading the nutrition labels and when we're talking about your limit, it's actually talking about sodium levels. But with food, typically you add salt to your food and that contains salt. So you do have to limit your salt as well. So we talk about them both together. So here we can see 1 teaspoon of salt equals 2,300 milligrams of sodium. And that's already over your 2,000 milligram sodium limit. So be careful with that salt shaker. For meals, this breaks down to less than 600 milligrams of sodium, and for snacks, that's less than 140 milligrams. Also, if you're used to eating salty foods, just so you know, your salt sensitivity does adjust, and it will make it easier over time for you to follow a low sodium diet. So now we're going to play a fun game of guess the amount of sodium that are in products that you commonly eat. So do you think these meals follow the sodium guideline of 600 milligrams of sodium per meal that I mentioned earlier? Well, let's take a look. So here we have a tablespoon of ketchup gives 180 milligrams of sodium. That's already over your snack portion. So just think about how much you add to your meals or if you're eating fries or hamburgers. Then we have a KFC chicken thigh with 860 milligrams of sodium. That's already over your meal intake. Canned soup is also really high in sodium too, with 790 milligrams at just 1 cup or half a can. Here we have a McDonald's cheeseburger, a cup of noodles that I've definitely seen my patients have, and mixed seasonings with salt. Those are high in sodium, as we can see. Then we have the famous and popular Chipotle burrito. So I actually entered this into their online website nutrition calculator. So I put in a steak burrito with salsa, cheese, beans, sour cream, and rice, and we get a whopping 2,740 milligrams of sodium in one burrito. That one burrito already exceeds your entire day's worth of sodium. Deli meats are also high in sodium. 2 slices at 500 milligrams is within your meal goals. However, if you add an extra slice of meat, extra cheese, and bread, you will go over. If you feel like dining out, we have a Cheesecake Factory grilled ribeye steak with mashed potatoes and green beans. Again, this one meal is over your whole daily allotment. And you do have to watch out for pasta sauces and sauces in general. They add a lot of salt to it as well. So essentially, the high sodium foods that you want to limit and avoid are restaurant and fast foods, processed meats, mixed seasonings with salt in them, canned soups, broths, or bouillon cubes, condiments such as ketchup and soy sauce, cheese, and gravies and sauces. I know it sounds like a lot of food that you eat have sodium and salt in it. So the best way to limit it and control it is by trying to cook more at home using fresh fruits and vegetables. You can make your own soups and broth without store-bought broth or adding bouillon cubes to it. You can season your foods with Mrs. Dash, which is a mixed seasoning that doesn't have salt in it. You can use pepper, herbs, lemon, vinegar, or salt substitutes if you don't have any kidney issues. If you buy canned foods, choose the low sodium options or consider rinsing it under water. You can buy low sodium snacks such as unsalted nuts and pretzels. Choose low sodium cheeses such as Swiss cheese and mozzarella. Also watch your condiment portion sizes, and when you are eating out, you can ask to have your sauces and salad dressings on the side, or ask the restaurant to not add extra salt to the meals that they're preparing. So here's a quick guide to reading a nutrition label for when you want to figure out how much sodium or carbs you're eating. First, you want to look at the serving size here because the amount of calories or carbs that are listed on this label is for that one serving. So if you are eating more than this portion, you will have to double or triple the amount accordingly. Here you can find the calorie amount. This is the sodium amount. So let's take a look and see if this meets your meal guideline. So it's 160 milligrams. So yes, that's okay because it's less than your 600 milligrams. Here is your total carbohydrate. You don't want to look at the total sugars. The focus is on the carbs. And so here's where you can look to see if it fits your bedtime snack of 50 grams of carbs. And here's your protein. So if you have fluid building up in your stomach or legs, or you're on diuretics or water pills to help get rid of water, your doctor may have told you to not only watch your salt and sodium intake, but also your fluid intake. Generally, we recommend a moderate fluid restriction of about 1.5 to 2 liters a day. This is equal to about 4 standard 16-ounce water bottles. However, it's not just water that counts as your fluids. There's also coffee, tea, other hot beverages, fruit juice, vegetable juice, smoothies, soft drinks, lemonade, and milk. Additionally, anything that ends up melting into a liquid also contributes to your fluid intake, such as ice cubes, watermelon, ice cream, sherbet, sorbet, and popsicles. And lastly, soup as well counts. And then actually another thing that I want you to make note of is that even if you are feeling dehydrated because of the diuretics that you're on, you're still gonna have to watch your fluid intake. So if you feel thirsty, sip slowly on water, suck on candy or chew gum. Don't guzzle a lot of water to quench your thirst while you're on diuretics. Okay, myth or truth number 3, taking supplements will help my liver. So this is actually a trick question. This is both a myth and truth depending on what supplements you're interested in taking. So there are many different types of supplements out there that I will go over. The main thing I really want to emphasize is that supplements are not regulated by the Food and Drug Administration. So the supplements can be contaminated, they may not contain what it actually says, or have false claims. So don't take any exotic supplements with claims for detoxifying your liver. Please ask your doctor or dietitian before starting any vitamin or herbal supplements. If you are looking for a trustworthy supplement, choose one that has this USP label that you can see here on the bottle, as they do test the products for purity and other things. So if you're interested in protein powders or nutritional supplements to meet your high calorie and protein needs, I really have no issues with them. You do want to choose one though that is both high in protein and calories. I have a lot of patients that are malnourished that only focus on the protein, and so they choose the really high protein shakes, but they end up being very low in calories, like Premier Protein, Ensure Max, Boost Max as well. So please watch for both. Also, don't get protein powders with a significant amount of creatine in them because they can be damaging to your liver. Also, you want to avoid very high protein supplements or shakes or powders that have more than 30 to 40 grams of protein per serving, because again, your liver may not be able to handle that much, and it can worsen your hepatic encephalopathy and cause confusion from such a high dose of protein. There are also many different types of protein powders out there. We have a dairy source like whey. You can also find vegetarian or vegan sources like pea and soy protein powders. They're all great options, so choose whichever suits your preference and taste. Branched chain amino acids, that was also discussed by Dr. Raju earlier, tend to be found to have low levels for people with cirrhosis. And so you want to aim for about 15 grams of branched chain amino acids a day. And the reason why is because these are essential amino acids, so they are not produced by your body and they have to be obtained from food. So as you can see here, this is found in a lot of protein-rich foods, so you don't need to take extra supplementation of branched chain amino acids if you're eating enough. But if you aren't eating enough, it has been found that the supplementation of branched chain amino acids can improve hepatic encephalopathy and your muscle mass and strength. So I still wouldn't recommend getting any specially made protein powders for branched chain amino acids, because as you can see on this chart, whey protein and soy protein and pea protein that's not listed in here also contains branched chain amino acids, so regular protein supplements and shakes is enough. As liver disease progresses, the prevalence of vitamin deficiency increases. And studies have shown that 40 to 90% of patients with end-stage liver disease have found to have vitamin A, vitamin D, and vitamin E deficiency. If you are not meeting your calorie and protein needs, you could consider a multivitamin without iron if your iron levels are normal. I would be cautious about taking excessive iron because your liver can build up in it easily and damage it. Certain medications prescribed by your doctor for your liver condition can also cause micronutrient also cause lower micronutrient levels. So therefore, it's important that your team checks your vitamin and mineral levels. And again, talk to your doctor and dietitian if you want to start any vitamin supplementation. All right, into herbal supplements that I know many people have questions about. We're going to talk about the most popular one, which is milk thistle, because maybe it's helpful against liver disease. And so research has shown that the supplement was not found to be more effective than placebo. And what's worse is that high doses have been shown to worsen your liver enzymes. So I would not recommend milk thistle. If you're interested in other herbal supplements, I still would want you to be cautious about it because, again, herbal supplements are not regulated by the government. And so they can have contaminants as well and damage the liver. And these contaminants have been shown to cause drug-induced liver injury as well. So here at Stanford, we recommend for all our patients to stay away from herbal supplements. There is increasing evidence that intestinal dysbiosis or gut imbalance can contribute to the development and progression of liver disease. So here are some ways that you can help promote a healthy gut microbiome. We recommend eating a healthy diet rich in fiber and antioxidants, a diet that's low in processed foods like the Mediterranean diet. Fiber, also known as prebiotics, is actually food that feeds the probiotics or the friendly gut bacteria in your stomach. Please avoid alcohol. And you can also add probiotics to your diet from foods like pickles, fermented foods, or yogurt, kefir, miso soup, and kombucha. But if you are on the transplant list, kombucha does have alcohol in it, so you would want to avoid that. You can also take a probiotic supplement. Okay, for our last myth or truth, I should not exercise because of my condition. Liver disease loves to use your muscle for energy, whether you like it or not, so you must perform strength training exercises to rebuild that muscle. And eating more protein alone isn't enough to replete your muscle. So, without a doubt, this is a myth. So our recommendation is to do cardiovascular exercises such as walking 2 to 3 times a week and strength training exercises at least twice a week. This is really important because it can increase your muscle mass and strength and decrease malnutrition, sarcopenia, and frailty, which is weakness, which we often see in people with liver disease, end-stage liver disease. Also, studies have found that transplant recipients participating in a structured exercise and nutrition regimen had a significantly better gain in activity level, quality of life, and exercise capacity after transplantation. This is important to know because your body may not return to normal even with a new liver after transplant. So in order for you to improve your ability to recover afterwards, you must exercise and strength train. Even then, it can take up to a year for your body to return to normal afterwards and be able to build muscle properly again. So you can start strength training exercises at any level. You don't have to go straight to the gym, lifting those 50 or 75-pound weights. Start just doing some chair exercises like you see here, or balancing exercises, or even wall push-ups. You can use 5 to 10-pound weights to begin with and start with 5 to 10-minute exercise sessions. So in summary, if you are malnourished, underweight, or not eating well and have muscle loss, you want to follow a high-calorie and high-protein diet. Eat small, frequent meals and snacks, especially at bedtime. You want to watch your sodium and fluid intake. If you're having swelling in your stomach area or legs, add exercise, especially strength training. You and your team can monitor your vitamin and mineral levels. And also it's really important to keep your gut microbiome healthy because a healthy gut is a healthy liver. So thank you so much for sharing your time with me, and I hope that you found this really beneficial. And we will now move on into the question and answer portion of our webinar, which will be moderated by our nurse practitioner, Caitlin Killian.
All right, if all of our panelists can please show their video so we can see you. We're missing
Okay.
Diti.
Can you see me?
Okay, and then a word to the attendees. If you look in the upper right-hand corner of your meeting screen, you'll see something that says gallery view or speaker view. You can go ahead and choose your view preference right now if you wish. And we will begin Q&A.
Okay. So thank you, Yvonne and Dr. Dronamaraju. Those presentations were very informative. We do have some questions that have come in prior to our seminar and also during. So we're going to start. The first question will be for Dr. Dronamaraju. Are there different stages of cirrhosis, and can diet help to slow the progression or reverse the process of cirrhosis?
That's a great question. So we have different ways of grading how much scarring is in the liver. There's different scales. The one that we more commonly use is goes from a stage 0, which is no scarring at all in the liver, to stage 4, which is enough scarring to call it cirrhosis. So stage 4 is the last stage, and that is cirrhosis. Within cirrhosis, patients can have varying presentations. They can either be compensated, which means that their liver, though it has scar tissue, is still able to do the job it's supposed to do for them. And there can be patients who are decompensated. And these patients are struggling with some of the symptoms associated with the liver not being able to do the job that it needs to do for them. And those are the patients that have fluid building up in their bellies and in their legs, confusion, which is known as hepatic encephalopathy, and they can have jaundice as well. So diet can affect the progression of liver disease, and that's really well documented in patients who've got fat in their liver, or patients who have any other type of cirrhosis, but who also have a tendency to carry weight on the liver, because we know that weight and that fat that sits in between those liver cells leads to inflammation in the liver and can cause that liver disease to progress more rapidly. So in general, maintaining a high protein, low fat diet is good advice for anybody with liver disease, not just people who have fat related liver disease. And we know that if you can lose the weight, that the fat can actually go away from the liver very quickly, and that may help slow down the progression of liver disease as well.
Okay, perfect. That actually brings us into another similar question, Dr. D. Somebody was asking how much weight, or is there a specific percentage that somebody should aim to lose to start reversing some of the damage that is done in the liver?
Yeah, so I mean, there are a number of studies that have looked at this, and we know that if you can lose a goal weight, if your liver disease is related to fat, we generally recommend that our patients aim to lose 7 to 10% of their body weight, because we know at that level of weight loss that we see the fat going away from the liver, and we see the reduction in the inflammation surrounding the liver in that percentage of body weight. Patients who lose up to 5%, even those patients will see benefit. So generally we aim to between 5 and 10% of your body weight, with that target number being about 7%.
Okay, perfect. Yvonne, we got a lot of questions about specific diets, but this question says, should somebody with liver disease restrict all foods that are either high in carbs or high in fats?
Yeah, thank you. I see a lot of diet questions coming in. So I do want to preface that this presentation was mainly on for those who are underweight and not eating well. We do have another webinar that we did earlier that was on fatty liver, and that is on our YouTube page that Caitlin will share at the end of our Q&A, that you can find more information about following a diet for weight loss. And so, yeah, so it really depends on what your goals are again. So if you're just not eating enough at all, I'm not as concerned with what type of fat or what type of carbohydrate you're eating. I just want you to have something. However, the main focus is if you are to get fat, and if you do have the option to choose what type of foods you put in your body, carbohydrates that are with fiber in it that are complex is better for you. And then healthy fats, unsaturated fats, like the avocado, the olive oils, the ones that are more room temperature or liquid at room temperature, those are better for you than the animal fats and saturated fats. And again, it's all about the portion size as well.
Okay, thank you. I know you mentioned, Yvonne, about exercise and how important that is, but we got some questions regarding different types of exercises, specifically aqua exercises, and if those are also beneficial for patients.
Yeah, definitely. I encourage you to find any exercise that you enjoy doing that you can keep up with, and that you would want to continue doing it for every day, every week. So find something that you enjoy. Aqua exercise is great for you.
Perfect. Dr. Dronamaraju, we got a question regarding different etiologies of liver disease, what caused their liver disease. And somebody is asking the difference or how to determine alcohol-related liver disease as a diagnosis versus a non-alcoholic fatty liver disease.
Yeah, that's a great question. And I think this is something that we as hepatologists are dealing with every time we see a patient who has one of these two diagnoses potentially. They can be very difficult to distinguish. There are some trends that we may see in the labs that may push us more towards the diagnosis of alcohol-related liver disease as opposed to fatty liver disease. But a lot of it is based on the clinical history of a heavier type of alcohol use in the past. There are some changes that we can see on pathology specimens of the liver biopsy that might also go along more with alcohol or more with fatty liver disease, but we're not doing biopsies as much as we used to. So a lot of times our diagnosis of whether this is fatty liver disease or whether it's alcohol-related fatty liver disease is based on their clinical history and sometimes looking at the labs as well that would go along with one versus the other.
Okay, great. Just to follow up on that, we all get probably asked quite frequently, and this question came in about somebody who has like a fatty liver disease or maybe some liver disease that's not cirrhosis or even cirrhosis, but is there a safe amount of alcohol for somebody to consume? And if so, how much would that be?
Yeah, I don't think that we know the answer to that. I don't know that we have a safe amount of alcohol that we can recommend for patients who already have underlying liver disease that's significant enough to cause cirrhosis or a stage below cirrhosis. So in general, the general recommendation is to avoid or really minimize alcohol use. Certainly, if you have underlying alcohol-related liver disease, no amount of alcohol is okay. But we know that alcohol is a direct toxin on the liver. So for anybody who has liver disease, we really generally say to avoid it as much as possible.
Okay. This one is for Yvonne. The patient is asking, what would be some good bedtime snack options if you are also a diabetic patient and worried about your glucose control?
Yeah, so even if you are diabetic or even if you are trying to actually lose weight, we still recommend a bedtime snack high in carbohydrates because again, we just want to avoid that fasting period, and that's what happens when you have liver disease. So a lot of times I will work with either the endocrinologist or your doctor if you're on insulin, that I would have to give you insulin to help cover for that bedtime snack. And again, you want to do a complex carb with fiber because that will lower, that will keep your blood sugar from rising too rapidly, and then also a little bit of protein too, because that can also help as well.
Okay. The next question I'll also give to you, Yvonne, and the patient is asking, is coffee beneficial for the liver? And if so, is there a certain amount that would provide the benefits?
Yeah, there's actually more and more research coming out that coffee is pretty protective of your liver. It can improve the fibrosis, decrease the inflammation, and things like that. However, it is dose dependent, so it depends how much coffee you drink. So they found that you know, you have 1 cup of coffee or 8 ounces is a standard cup, provides maybe a decrease in risk for cirrhosis by 20%. You go up to 43% with another cup, all the way up to 4 cups. So I wouldn't recommend adding coffee to your diet if you're already not drinking it, and it can't reverse all the lifestyle changes. If you're eating poorly in your diet, you're not exercising, I don't think it would have a greater benefit than that, but I don't think there are too many downsides if you're already drinking coffee, and they still are trying to figure out what about coffee that makes it good for your liver.
Okay, great. And I point out that I think most of that's done with black coffee without the extra cream and sugar and everything else that we sometimes put in it that's yummy, right? So, okay, Dr. Dronamaraju, we get this question all the time, but the patient is asking, what is a safe amount, if any, of Tylenol to use? Can somebody with liver disease use Tylenol for occasional use, and when should they cap it off?
Mm-hmm. Yeah, we get this question quite frequently from our patients in our clinics. You know, Tylenol is cleared through the liver, so if you're overdosing on Tylenol, it has a risk of causing liver failure. But we do say that it's okay to take, even for patients with underlying liver disease, in small occasional amounts. So what is that occasional amount? Typically, we recommend 2 grams of Tylenol in a day for short intermittent usage if you've got, you know, flu-like symptoms or a headache or something like that. So 2 grams of Tylenol ends up being about 4 extra strength Tylenol over the course of 24 hours. And that's fine. You know, some of the other medications that people ask about is ibuprofen okay, Aleve, naproxen, these types of things. And again, I mean, the worry with those medications, unlike Tylenol, is that they're cleared through the kidneys. And we know a lot of our patients have kidney dysfunction to start off with because of their underlying liver disease. And sometimes those lab values that suggest that their creatinine or their kidney function is normal may not actually be what's normal for them. And so we do say those types of medications should also be limited to very occasional use, if at all.
Okay, great. Yvonne, we got a couple questions about specific diets, but this question is regarding the Optavia diet, which it can be used for rapid weight loss. And if this is recommended, are there pros, are there cons to this type of diet or similar ones that provide rapid weight loss?
Yeah, so I actually had to look up this diet. I'm not as familiar with it, but online it says it's an 800 to 1,000 calorie diet, so it's very low calories. It's also low in carbs, 80 to 100 grams of carbs. Most people eat 200 to 300 grams of carbs a day, but it does contain at least 72 grams of protein. So at least it meets the protein requirement. However, studies have shown that rapid weight loss can cause and worsen fatty liver and inflammation and all of that. So I would not recommend following a very low calorie diet to start losing weight rapidly. So if you are interested in intermittent fasting again, if you're in end-stage liver disease, again, you don't want to do that because your liver will run out of energy and then it will break down your muscle. So if you are interested in losing weight and want to do a more gradual, healthy lifestyle changes, again, I would go to the Fatty Liver webinar to watch more about that. But the other thing to note is, again, you don't want to skip meals to lose weight. You don't want to only eat fruits and salads, because I have some patients do that and they forget about the protein. You got to have your protein, and then you also have your bedtime snack if you want to lose weight safely while you have liver disease.
Okay. Another question for you, Yvonne, is what are your thoughts about apple cider vinegar, and are there any health benefits to the liver?
Yeah, there's some research, a little bit of research that says that maybe it can help with losing weight, maybe improving your lipids, your cholesterol levels, and possibly maybe help with your blood sugar control. But a lot of the studies done on humans are very small, 10 to 20 people, or a lot of the studies are also done on mice. So there's just not a lot of information out there where I would encourage you to do it. but it doesn't seem too harmful. So if you like it, it's okay. I would just do at most 1 tablespoon or 2 tablespoons at the most. If you have acid reflux, it could trigger that because it's acidic, and it could also wear down your enamel in your teeth. So this wouldn't be something that I would generally recommend for everyone to do. Right, yeah.
Okay. Dr. Dronamaraju, this patient is asking if you can offset your sodium intake by increased hydration, drinking more fluids. And kind of to tie that in, somebody else had asked, what is somebody's dry body weight? How would you tell that?
Mm-hmm. Yeah, it would make, theoretically, it might make sense that maybe you could dilute the sodium by drinking more water, but what we can generally say is where salt goes, water will follow. So if you're eating a high salt diet, the water is just going to track into where the sodium is. So it's not really going to work to try to hydrate more and maintain the high salt diet. That is likely to cause ongoing swelling. And what we find is that for patients who are requiring water pills, oftentimes if they can really follow that low sodium diet, we can often come down on the dosing of the water pills, or for some people even stop the water pills. So it's a really effective way to prevent the swelling in the legs and in the fluid from building up in the belly. But it is a very difficult thing to follow. But if you can follow that 2-gram sodium restriction, with a moderate amount of fluid intake. So like we said, just a normal amount of water, as Yvonne had pointed out, that's a great way to try to combat this issue of swelling. But unfortunately, eating a lot of salt and then try to hydrate more is not going to work. In terms of the dry body weight, so dry body weight really refers to the body weight without having extra fluid on board. So this is a term that we use in patients with underlying liver disease. It can be used in patients with underlying kidney disease. But we know that these are both conditions where fluid has a tendency to build up, and that will affect the weight. So the dry body weight refers to your weight when you don't have that extra fluid on board. And whether that be, we may be able to determine that after your paracentesis when the volume has been taken off, or if you have a good weight that you were at before any problems started, that may be also used as your dry body weight.
Okay. We are running low on time, so maybe a couple more questions we can fit in. Yvonne, this is a good question. Somebody's asking, how can they tell if they're malnourished? I think Deepti talked a little bit about muscle wasting and things like that, but are there any other signs, maybe lab work, that you can tell somebody may not be getting the nutrition that they need?
Yeah, so usually for malnourishment, how we assess for that, we do have a criteria for that. And typically it's basically what percent of weight did you lose over a certain amount of time? We also have equations that we can calculate how much calories you should be getting. So I will do a diet recall to see how much you're eating, and then I'll compare to see what percent are you meeting your needs. That will also tell us if you're malnourished or not. We do a body assessment if you work with me, so I will assess your muscle and fat stores on your body. And then also fluid accumulation. If you have a lot of fluid building up in your body, that can actually count as one of the criterias for muscle loss or for malnutrition. And then also you can measure your hand grip strength, where if you are in clinic with me, we would be doing that as well. So that is the standardized criteria that we use for assessing if you have malnutrition or not. And so if you're at home trying to figure that out, just compare it to how much you were eating before, and then just see in your body if you're noticing your collarbones are showing more, your triceps are just a little looser than before, there's just not much there to pinch, or if you notice your temporals here are just caving in a little bit, then you are losing some muscle.
Okay, very informative. So unfortunately, we are out of time tonight. We want to thank everybody who came to participate, who offered questions. We're really sorry if we could not get to everyone's questions in our time frame, but we encourage everybody to contact their care provider, and we'd be more than happy to answer additional questions or get you in touch with a dietitian or the resources that you need. We are offering other webinars, so we encourage everybody to go to YouTube and subscribe to our channel. It's the Stanford Gastroenterology and Hepatology channel. You can find all of our other videos. Otherwise, we hope to see you soon and answer all of your other questions in our clinics.